So, to try to help the healing process, first it starts before surgery, trying to maximize nutrition and make sure that someone's health is in a good place coming in. If somebody has medical issues, making sure that those are in a good, stable place to limit the risk of certain healing issues or challenges. And then after surgery, I think trying to actively manage the healing process with taping, compression, some massage, things like that is helpful to control the scar formation early on. And then I always encourage people to keep their incisions out of the sun or out of tanning beds, no UV for at least a year. Otherwise, they can get dry and itchy early on, which is annoying but not super problematic. But they can get permanently darkened in the sun. So I am a big fan of taping them early on for the first 3 months. Sometimes that's with paper tape, which is pretty easy and low maintenance, but not everyone's skin tolerates that. Sometimes it's with silicone taping or sheeting for sensitive skin, or just sometimes it's more comfortable. And there are certain, depending on which you pick, specifics to when to apply and how often to change. But in general, those are both usually really well tolerated, and they really seem to keep the scars flatter and thinner. They limit overproduction of collagen, I think, a lot. And then once you get past the first 3 to 4 months, depending on how that early healing process goes for you, then I tend to switch over to different moisturizer creams versus scar creams, depending on what's going on and how things look. We have photos on display at portlandplasticsurgery.com, also on our socials. And if you come into the office at any time, I can show you a list of before and after photos of folks who maybe weren't even comfortable with them being out in social media or out on the computers, but that are really happy with their results and happy to share with prospective patients.